Hi everybody, I'm going to be demonstrating sitting around the room, so just basically going through my case card and opening up my sterile field for both Competency Assessment 1 and Competency Assessment 2 Laparotomy. In Competency Assessment 1, you'll have 30 minutes from the time you open your back table to the time you break out of your gown. Okay, so the first thing we do when we come in the OR is you'll come and locate your case card. So I'm going to go ahead and do that, and then the next thing I'm going to do is find my doctor preference card, which you'll find on top of your case card. So this is what we're going to utilize to go through our case card, separate our open from our hold items as we begin opening for the preoperative phase. Okay, so as I'm looking through this, I'm looking at the quantity versus hold, or open versus hold. Some facilities will use quantity, some will use open. So whatever is on open, that's what I'm going to put on a separate dry surface to be opened up onto my sterile field. Okay, so as I'm opening my case card, I'm looking through my preference card, identifying, again, what am I opening and what am I leaving on hold. Everything that's on hold, I'm just leaving inside the case card. Okay, so the first thing I notice is my laparotomy pack. So this is going to go ahead and go in the middle of my back table. Okay, and then looking through this, I have one basin set down here. That's going to go on the first drink stand. And as I'm kind of setting up my room, this is what we call sitting around the room, I'm kind of making sure I have enough distance. So remember, anything that's unsterile, we want 12 to 18 inches. So give yourself plenty of space from any walls or unsterile surfaces. Okay. Next thing I have is my instrument set, so my laparotomy set, and that's going to go on the outermost drink stand I have here. Okay. Next thing I have is my gown, which I have one open and one hold, and then my gloves, which I am opening 7.5. Okay, so I just like to utilize the patient's bed. Obviously, you can utilize any other dry separate surface, but that's one location I like to use. Okay. I pack a laps, I pack a Raytex, and again, I'm just reading through this. Okay. I'm going to try and be as efficient as possible and kind of look through this whole thing to kind of make as least amount of trips as I possibly can. Okay, so the next thing I have is my suture, my light handles, and then lastly, my Balfour. Okay. I'm just making a trip over to my OR bed, setting all this down. And then I'm going to do the same thing with my Balfour. I'm just going to place it on the flat surface for my circulator to open up to me later on. Okay, so I'm going to give this one look over to make sure I have everything accounted for opening. So I have my gown, my gloves, Raytex, my laps I have, laparotomy pack, light handles, my basin. And yes, I am ready to go. Okay. All right. So I'm creating space again, like I said. Okay, so this is when I'm going to go ahead and remove my laparotomy pack from my desk cover here. I'm going to go ahead and check my desk cover for any holes or rips or tears or anything that would compromise the integrity of the package. If it did have a hole in it or a tear, then I would have to get a new pack. Okay? All right. So at this point, I'm going to go ahead and open up my back table cover. Okay? So this is when your 30 minutes starts. So I'm going to take this tape off. The first flap is going to open up away from me. The second flap is going to open up towards me. Okay? Then I'm going to go ahead and step around. Again, creating space. Remember, everything's on wheels. Okay, so I'm reaching below table level here and pulling towards me. Notice how I'm bending at the knees and not the waist, because if I bend at the waist, then my head starts to come over the sterile field. Okay. Notice how I'm always facing my sterile field, maintaining 12 to 18 inches. Same thing on this side. Okay. Now that I ended up here, I'm going to go ahead. So I always start from my back table and work out. So the next thing I'm going to do is open up my sterile gown. So I'm going to go ahead and check my dust cover. Again, same thing, making sure there's no tears or rips or holes. Dispose of that. Okay, and then my first flap is going to, again, same thing, this is envelope wrap, so my first flap's going to open up away from me. Then I have my two side flaps. And my last one opening up towards me. Okay, make sure you control all edges. Okay. And then, like I said, we're moving outwards. So my next thing I have here is my basin. So this is the same concept as my gown. It's envelope wrap. So first flap, I'm creating space. I'm going to open up away from me. My two side flaps. And then my last flap is going to come towards me. Okay, and then to move it, I'm going to grab underneath here, below sterile level, and move that, again, 12 to 18 inches away from my back table. Okay. Next thing is my laparotomy set. Okay. So I have two external indicators plus my filter. Okay, so I'm checking these to make sure they have turned properly black, and then make sure I have a filter up top, which I do. Okay, so I'm going to go ahead and pop these. So I cover them with one hand and then lift up this bottom lever to release it. I'll show you again on this one. So I'm covering my indicator here and then pulling up on this to release this handle here. Okay. And the next thing I'm going to do is I'm going to open this up just like a hot pan. Okay, so I'm going to kind of rotate back and away. Okay. Now my top filter here, so I'm going to go ahead and take this lid off. This can go here. Notice again how I'm bending at my knees and not at my waist. Okay, and I'm going to check my filter for any holes, rips, or tears. And then this is going to go back over here. Okay, now I can begin opening up all my sterile supplies. Okay, so it doesn't matter what order you go in, as long as you just get everything open. And you have 3 tries to get all sterile supplies onto the field. So if you miss, not a big deal, everybody misses. Just go ahead, ask for your circulator to get a new one, or you can grab one yourself and then keep on opening. Okay? So my light handles, so they can either go in my basin or my back table, it doesn't matter. Okay, so I'm just going to shoot for my back table. So the concept for this, again, 12 to 18 inches, and I'm going to kind of use my rocker feet. So notice how I'm staggering my feet here. So I'm going to rock from my back foot forward and release. Okay? And then I'm going to go ahead and check for any holes. That is good. Okay? I'm just going to keep moving forward. So next thing I have is my lap sponge. So I'm removing them out of the dust cover, checking for any holes. Looks good. And then I have my envelope wrap just like my gown in my basin. So I'm holding the contents of my package in my right hand, and then I'm going to go ahead and open up my first flap away from me. And notice how I'm kind of rotating my wrist to go ahead and open up these side flaps. Same thing here. I don't want to reach over and possibly contaminate, because obviously the sponges here are sterile. Okay? Okay, and then my last flap is coming towards me. I'm going to keep a hold of this while I'm keeping a hold of my corners that are on the inside here. Okay, so same thing here. So this can go on my back table. I'm going to maintain my distance, rock in, roll forward, and toss on. There's not much force that needs to go behind these. You don't have to really rock it on there. Okay, so next I have my Ratex. Okay, so I'm going to go ahead and peel this package open. And then I'm going to kind of shock put this on. Same concept. So rock forward, or rock back, rock forward, and shoot away. Okay, check for holes. That looks good. Okay, next I have my suture. Okay, so with suture, I don't want to open this up all the way, so we use a concept called crack and shoot. Okay, so I'm going to crack the package. Okay, I'm going to rotate my body so I'm right-handed, so I'm having my right hand to the back side. Okay, and then the next thing I'm going to do is I'm going to keep my left hand stationary while my right hand goes on top, or goes over top my left hand while I rock forward. Okay, so rock forward, right over left, just like so. Okay, check wrapper, that looks good. Okay, next I'm going to go ahead and do my gloves. So this is my outer glove, so this one's going to go on my back table. So I'm going to go ahead, open this up, controlling my edges, making sure my gloves don't go over the heat seal edge, otherwise I'll contaminate. Okay, and then this outer glove, the white glove, is going to go on top of my back, or on my back table corner, closest to my gown. Same concept here. Okay. Okay, I'm going to do the same thing over here. I'm opening up my gloves all the way. Otherwise, because of these pockets, they like to tend to stick inside these pockets. So I try and release them as best as I can without going over the heat seal edge. Okay. I'm going to go ahead and do the same concept, 12 to 18 inches for my gown. Rock forward. And it sticks. Okay. All right. So I have everything open. Okay. And then the next video is going to be me scrubbing in and organizing the sterile supplies. Thank you.